Hi, welcome to Conversations with Kaufusi. It's Mayor Kaufusi, and I am here with Chief Miguel. Look at that guy. He's one of the best in our city. We all adore him, and he's one of the hardest working fire chiefs around. But before we start, I just want to state, I want to thank everybody for reaching out to me and reminding us that we need to make sure we are social distancing. So with Conversations with Kaufusi, we are going to make sure we're 6 feet apart. And we're also going to make sure we each have our own microphone. So thank you for caring enough about us and calling me and emailing me and letting me know that I can do better, because I'm learning and we're all learning and we are going to figure this out. So thank you. Let's get started, Chief. This is, first of all,
I'll reel this in. We'll keep our distance.
We're super excited because we're in front of a red fire truck. This is the best backdrop.
Yes, it is.
Everyone wants to be in front of a red fire truck.
Yes.
So talk to us a little bit. These interviews, we've been mostly focusing on how COVID-19 has changed the way we do business in Provo. So my first question is, what happens now when one of our citizens calls 911?
One of our, in addition to the service that we are providing, one of our most critical needs right now is to keep our firefighters and police officers healthy. And so when you call 911, you typically would not have been asked questions about people in the household and whether they are sick or anything that might indicate that your home is one that we might want to be careful in. So you will be asked, whether you're requesting a police officer or a firefighter, you will be asked, is there anyone in your home that is exhibiting flu-like symptoms, anything that we should be concerned with? The second thing we will ask you to do is, if the patient or if the person needing the police are ambulatory, meaning that they can walk, we will ask you to move them hopefully closer to the front door. We are trying to avoid going deep into residences to try to keep our people safer than they might be if in fact they enter a home that is full of the virus.
Okay, great. My next question is, what are firefighters doing to keep safe during this time?
Well, again, we will look a little different when we come into your home. Prior to this national emergency, we would come into your home and oftentimes we would just be wearing glasses and we would be wearing rubber gloves. Now, you may see us come in and we'll be wearing quite a few things. You may see us in what's called an N95 mask. And this, when we walk in, you will see us, we will actually be wearing this. You may see us in one of these, and this again is an N95 mask that you may see. And one of the things about this mask is that when we come in and meet with our patient, it is very likely that we are going to place one of these masks on the patient. The patient you can breathe right through it, and it just limits the amount of particles that might be emitted into the air, and so we may place this actually on your face. If we do place it on your face, or if you cannot tolerate it, then we may ask you to tolerate some oxygen. So we may put some oxygen on just to, one, make you feel better, and two, the oxygen mask will again keep the particles from filling the room, and you're sharing them with the firefighters. Some firefighters, if the answer to the question, is anyone in your home sick, you will see firefighters that come in these gowns. And these gowns are disposable. They also are a challenge to put on, but they're disposable. And we will put these on to keep us safe, to keep our uniforms safe, and to keep our uniforms clean. And again, we may also be seen wearing one of these masks. We will have eye protection. If we come in and we feel like you need eye protection, we may actually place one of these on you as the patient. So this is what you may see when we walk in the door, and it's not to be alarmed. It is not to be taken offense to. The idea is that we want to keep you as safe as possible, and we want to keep us as safe as possible. And this is how the CDC guidelines tell us we can most effectively accomplish that. So Mayor, those are the things that you're going to see as we come in the door.
This is so helpful because it's different. It's not what they're used to seeing when they see you walk into their homes. And so this, I think, will really help people. And again, it goes back to our calm preparedness. Maybe you won't be as nervous if you were to see someone come in like this because you have seen, you've got the heads up, you'll still have this sense of calm that we're just following protocol and taking care of each other. So talk to me. A lot of people are wondering if I call for 911, and will that guarantee me a COVID-19 test?
This is a really common question, and the answer is no. That an ambulance ride to the hospital does not guarantee that you will be tested. As a matter of fact, it does not even guarantee that you will get into the hospital. If you have some of these signs and symptoms, you will actually be re-triaged outside in a portable tent for these symptoms. They're not letting anyone in the hospital unless they have had the opportunity to check them out. And then if you are brought into the hospital, you'll be brought into the hospital under special precautions. But if you don't meet the criteria for a test, the odds are good if you are not, if you're not ill enough to actually be admitted to the hospital, you will not even actually make it into the hospital. So an ambulance ride is not necessarily the way to get a test. And in addition, we may come and we may encourage you as we look at you, and we may encourage you to seek private transportation to the hospital. The hospitals have asked us to please to make sure that the people that we are transporting to the hospital are true emergencies and not just people that are feeling a little ill, not just people that are experiencing some of the symptoms, but the most sick people will go by ambulance to the hospital.
Perfect. All right, and then talk to us about what can the public do to help?
Well, we've done a few things. One of the things that we hated to do, but we have had to do, is we have stopped giving station tours. We've stopped making public visits. One of the things that our people enjoy most were school visits and having children come to the firehouse. Not only do we not allow the public to enter the firehouse, but we also we've actually asked our families not to come to the firehouse. So we will not allow our families into the firehouse, onto the apparatus, or anywhere in the station. So, it's unfortunate, but I think it makes sense to most people that in order to keep our firefighters safe and healthy, we have to keep them separated from the general public as much as we possibly can. What they can do to help. The CDC guidelines are so important. We too do not want to see this spread. We do not want to see our ambulance services just overwhelmed. We do not want to see our hospitals overwhelmed. And so the things that we are being told to do, the very simple acts of washing our hands, keeping our hands from our face, and keeping our social distancing, we are begging people to stay home, and let this curve pass so that we might sooner than later return to normal.
So he's so good, right? I mean, I'm just so encouraged now by your words. Is there anything you want to take us across the finish line with a positive message out there?
We are so grateful for the things that we are seeing, and we're seeing a tremendous amount of generosity towards us, a tremendous amount of concern about us, emails and texts asking us how we are and asking me how my people are, and we're so grateful for that support. People are asking if they can drop things by fire stations, and bless their hearts, we're not taking anything through the doors of the fire stations, but we're so grateful for their love and their concern, and we know that if we can all do what we're being asked, we know that this will be short-lived, and we will be able to return to normal, and we're all looking forward to that.
Thank you, Chief, and thank you everyone for joining us on Conversations with Kaufusi, and hope you're all hanging in there. This will pass.
Thank you.